Welcome all. Greetings from the Gurukul Global Academy, and I welcome in today's online clinical meeting. Brief about the Gurukul Global Academy. We have a mission of building the future of healthcare. We offer 25 plus super specialty courses in Ayurveda with the integration of Ayurveda and modern science. We conduct clinical meetings, workshops, hands-on training, CMEs. We start with the blessings of Dhanvantri Stavan. Next.
नमामि धन्वन्तरीरादिदेवं सुरासुरवन्दितपादपद्मं लोके जरारुक् भयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यं परिविलसन् मौलिमं भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारु पीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवन् प्रौढदावाग्निलीलं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम्.
For any inquiries, you can email us on the gurukul@parasnathclinics.com. You can also visit our website, thegurukulglobalacademy.co.in. For any queries, you can WhatsApp me on 9969119134. We are also available on social media. Next. Now coming to our today's clinical meeting, our topic is Samhita, Panchakarma and ailments. And our today's guest speaker is Vaidya Mehul Joshi sir. Next. It is my honor to introduce our today's guest speaker, Vaidya Mehul Harish Joshi sir. Sir is a campus director, Global Institute of Ayurveda and Hospital, Rajkot, Gujarat. Sir is a secretary of Ayurveda Vyaspeeth, Saurashtra Prant. Next. Over to you, sir.
Thank you, Dr. Dutt, sir.
Yes, sir. Please start.
First of all, I would like to thank Global Gurukul that you have given me an opportunity to say some thoughts. I would like to say it is not like a knowledge, but it is a kind of a thought that what I would like to share with you and all the participants. Basically, what we have given the name, the title is Samhita, Panchkarma and ailments. Generally, when we talk anything about the health perspective, we used to talk about ailments. So ailments, our basic target is to treat ailments. So either we go through medicinal approach, either we go through surgical approach, or we go through Panchkarma. Today we are discussing about the Panchkarma. So I have given these three things, but ailments will come in both the aspect of Samhita and Panchkarma. So what is Samhita? Next. Actually, basically, when we talk about Samhita, we think that it is a compilation of Ayurvedic knowledge, and we all know about the Charak Sushrut Ashtanga Hridaya. Actually, when we are studying BMS, I have passed BMS, and whoever has joined over here, everybody has gone through this phase. What we do actually in during the BMS phase, our syllabus is of that way or whatever for reasons, but we used to study largely Charak Samhita, some parts of Sushrut Samhita, and some parts of Ashtanga. When we see in the history that Charak Samhita, Sushrut Samhita, Charak Samhita, even in just recent times in Kali Yuga, it has been Prati Sanskrit, but Sushrut and Charak Samhita, they are ancient Samhitas. But when we talk about Ayurveda, we usually say that the Ayurveda is an ancient science. It is a true older. It is older, right? I accept. But the contemporary science is also Ayurveda, because when you study Bhav Prakash, when you study Saranga, Bhav Prakash is the latest Samhita written, and it is estimated around just when we can say that Portuguese or maybe British came at our land. At that time only, when even the Shivaji Maharaj or Sambhaji Maharaj was there, at that time this Samhita was written. So we can't say that we are just reading the old sculptures type of scriptures. We are not reading that. We are learning the contemporary science. Even when we think about that, before 1947, there were no great allopathy, not great, but great amount of allopathy colleges were there. There were Ayurvedic Gurukuls and Ayurvedic institutions. So Ayurveda was the first line of treatment for everybody. But now, for some reasons or whatever reasons, we have not been practicing that in that way. Sometimes we can say that we don't get Rajasray. So in that way also, we are just chasing that we have to be in a main line of treatment. So when we see our history, that Samhita and particularly even the Bhav Prakash, if we focus on that, it is the latest Samhita. And in that Bhav Prakash, once you will read, you will came to know that the Samhita is actually a compilation of the older knowledge. So older knowledge to use in the contemporary times, how we can assimilate things, you can study from Bhav Prakash. The Bhav Prakash book is written in a way that today's BMS syllabus, just like today's BMS syllabus is written. So I would like to add one thing, that you read Samhitas, then only you can go for something extraordinary practices, what you want to know or what you want to do. So what we have difficulties in reading Samhita and making some conjugation with Ayurveda and allopathy. Basically, as I told that our syllabus, the BMS syllabus is wholly designed to just sometimes you will feel that we are catching to allopathy. We are not establishing Ayurveda as Ayurveda. I actually felt good that your institution name is Gurukul. When we talk about Gurukul, there will be only teachings of Ayurveda. And when we see Ayurveda as Ayurveda, then only we can treat patient, or even we can think about the Panchkarma or any other procedure we want to do. Because as I say that when we say Amasay, we generally catch Amasay with stomach only. But when you see the sloka over there, it is written that it is located between Nabi and uh, Stanonantar. Means between two stun and nabi. So between two stun and nabi, there is a wide region which can include yakrut also. So you can't say that only stomach is amasai. When we are chasing allopathy, that we have gone in that phase that we have to just establish, or we have to prove that allopathy is the great science, and Ayurveda is just like that. So if we think in that way, then we can't go for a Ayurvedic. We have 700 to 750 colleges all over India, but yet we are not practicing so much Ayurveda. That much we can produce. So basically, my thing is that when you think about Samhita, you study Samhita and don't try to make adjustment of allopathy versus Ayurvedic, or Ayurveda is allopathy, and don't go in that way. Then you will get the exact anatomy, physiology, even you will get the surface anatomy of Ayurveda. Once you will get the surface anatomy of Ayurveda, you will be able to diagnose the disease. You will be able to treat patient accordingly. If you are doing any procedure on him or her, or if you are giving any sort of treatment or any sort of medicine, you will be able to diagnose first. Then uh, again, we have a problem of too many. When we talk about diagnosis, patient comes to us. Some people will see only nadi and they will diagnose the things. Some people will take srotas into consideration. Some people will go for prakruti and that kind of things. Some people will go as an allopathy thing, that you give a lakshana and I will think about the allopathy diagnosis, which resembles to the Ayurvedic diagnosis, and then treat. So we have problem of too many. Sometimes some pathy or something have little resources. Actually, when we talk about Ayurveda, we have too many resources, or too many Nidan Panchakas and all those things. So these things also, you can't, you have to go to guru, or you have to go beyond your syllabus to get through to the diagnosis, because once you will diagnose properly, then only you can give proper medicine, proper treatment. So many Agni Karma and Rakt Moksha workshops are going on. So many people are attending that also. But how many are practicing? People are not able to practice. The basic reason is that they don't know how to diagnose. See, Agni Karma is easy, we can perform. Rakt Moksha is also easy, we can perform. But if we don't know whom to do Agni Karma, whom to do Rakt Moksha, then there is a glitch in our practice. So, if you want to go for a perfect diagnosis, you have to be clear on your anatomy and physiology of Ayurveda. And when I talk about anatomy of Ayurveda, I recommend, as I will say that I am attached over here in this college, since this college has been came into consideration. I have been since then over here. So what I have faced that when we study Ayurveda, we are studying that we are studying, sometimes we are studying too much. When we say clone, one Samhita will say clone is in at palate, one will say clone is situated behind sternum or something like that. So you can't just take that this is the globe. And if you are not able to diagnose the clone, then you are not able to diagnose the Udak Varasota smooth. And if you are not able to diagnose Udak Varasota smooth, then you are not able to treat Trishna disease. I am talking about Trishna as a disease. Uh, uh, in my experience throughout, I have never seen any Vaidya is diagnosing Trishna, because when we talk about this kind of disease, there is some controversies or that which Samhita we have to go through, or which one we have to accept. See, all Samhita are right, all Samhita are great. But my point of view or my perspective is that you pick one Samhita, you follow that anatomy, you follow their treatment, you follow their protocols. Then only you can get more able, viable results. Second thing, I would like to say that generally what we are practicing over here, that the patient will come. We have studied Charak Samhita and we are diagnosing Charak Samhita according to Charak Samhita. And then what we will prescribe, we will prescribe Chandra Prabhavati. Now, if you have time, or even Dattaji, you can give me any two Chandra Prabhavati available in market with same content. Or you may go afterwards also. You just try it. You go and search two Chandra Prabhavati of same content. I think you will not get it. Every Chandra Prabhavati has their own content. At least minimum 2-3 contents are changed. So if the even one content is changed, then how can you rely on that medicine? So if you want to establish your practice potently, then you have to go through one Samhita. You have to go one Samhita's, that Samhita's anatomy, that Samhita's disease culture, and that Samhita's medicine and treatment protocols. So basically, I want to say that you establish one Samhita at a time. You may follow Charak Samhita, you may follow whole Charak Samhita. Then you have to see only Charak's point of view. Where did Charak Samhita gloom is situated, here or there? You just accept it. That is Aptavachan. You don't question the Charak Samhita now. But if you are expecting that you are diagnosing from Charak Samhita, and you are thinking that I will give medicine from Ashtang Hriday, I will give medicine from Bhav Prakash, then it will work, but it will not work that potently, that what we actually want. And second thing, again, I would like to remind you that Charak Samhita and Sushrut Samhita were written or came in establishment in maybe in a Dwapar Yuga. And other Samhitas like Bhavrakash, Saranga, they have been written in just recent times. So, in Dwapar Yuga, age was a difference. At that time, 200 years was the minimum age. Now we have 100 years as a minimum age. So, you have to take these things also in consideration. That at that time, if the medicines were that much of potent, after the Mahabharata Yuddha, there may be a climate change and whatever has happened. But now there will be some lack of potency in the medicines also. So if you want to establish yourself in a proper manner, then or in a successful manner, then you have to be a Samhita lover, and you have to be one Samhita lover at a time, not a multiple Samhita lover. You can read everything, but you follow one. That is my one advice, or whatever you think about it. It is by this way. So next, sir. Again, we talk about ailments. So what is ailments? ailments are basically the imbalances of dosas, and imbalances of dosas happens due to we have already read about it in Jor, etc. That simple improper diet, lifestyle, seasonal changes, everything can increase or decrease dosas, and you get disease. So this is not what I want to discuss more. Sir, next. Next. Now we talk about the Panchkarma. As I am Gujarati, uh, Panchkarma is a skill to earn, because one thing that I thought when I was in a UG, and when I started over here college again, if one is not able to earn by any means of practice, uh, he or she will not accept anything that which is not able to give any income, then we will not accept it. So, if you want lot of Ayurvedic practitioners, we should know how to earn. But there is also a important thing, that we should earn ethically. And what is ethical in Panchkarma or a Panchkarma practice? One thing that you treat, uh, one thing is that you treat patient. When you are treating patient, it is your obligation to give a health to the patient. But when we talk about health of one's anyone who is healthy or want to be healthy, then there are a few things that we have to consider. That we give them proper treatment, proper diagnosis, and proper hospitality. Then only we are, if we are taking any money, or if you are earning something from them, then it is ethical. But when we are giving them some side effects, and that patient may also not know sometimes, but sometimes we also don't know. Today, what I want to discuss about the thing is that Panchkarma is practiced Lord. So, what we are giving to the society, if we upgrade, or if we standardize this our procedures, Panchkarma, then we will serve the society, and then only we can, what we will earn, it is a Subh Lakshmi. So, one thing that Panchkarma, when you talk about it, it is a purification therapy, right? It is a purification therapy, but I have seen many people doing Sadhya karmas, Sadhya Vaman, Sadhya Virechan. And see, when you are knowingly giving Sadhya Vaman, Sadhya Virechan, that is not Panchkarma. You don't have to consider it as a Panchkarma. You are giving treatment in a emergency condition, or in your perspective for short needed. That is not classical woman or classical relation, and that you can that you can't establish or make a marketing that we have been doing the classical Panchkarma, or this is the Panchkarma. If we do this kind of some of the practitioners I have heard that they do Panchkarma in 5 days, and 5 different karmas. So, in Samhitas, if you have written, if you have read, you know that it is not possible in 5 days you are doing 5 Panchkarmas. So do proper Panchkarma. And if you are doing that 5 day procedures or whatever, and if you are getting results, name them differently other than Panchkarma. Don't name it as a Panchkarma, because society or a patient, they don't know everything about the Panchkarma. They will think that they have gone to the Panchkarma procedure, and they will not go to the another Vaidya also if he or she feels that I have done the Panchkarma and I have not got well. So whoever is doing, so try to name it differently so that it doesn't get confused with Panchkarma. Second thing, uh, side effect of Panchkarmas. When we do Panchkarma, when we do any Ayurvedic thought process, Ayurvedic diagnosis, Ayurvedic perspective, we always think about the person as a whole. We do not treat person as a subject. We treat person as a whole. We proudly market our Ayurveda as a holistic science. So, what is the meaning of holistic science? Holistic science is a body as a whole, as a you even take consideration upon a his or her manasthiti is also considered. Then we are treating a person as a whole. I have seen that uh, Panchkarma, sir, next, next. We are doing Panchkarma, and when we are not taking a holistic approach during the Panchkarma, we are causing problems for the patient. And that thing, knowingly or unknowingly, we are also not subjected or even aware that this has happened due to Panchkarma. So I would like to read this slok and make a context of it, that Suddhe Sariri, Suddhagni, Suddha Dhatu Malakriya, Prasannatmendriya Manaha, Swastha Iti Vediyate. It means when the body is properly purified, Agni, Dhatu and Mal functions became normal and health is restored. Next. But what happens if we don't treat properly? What happens when we are giving Panchkarma and we are not realizing that according to this patient, we have not given proper Panchkarma? These things happens. Ayogo ati yogascha mithya yogascha karmanam trividam dosakaritvam sodhananam prakirtitam. Inadequate, excess, or improper application of therapies can cause complications. Now, when we talk about Ayurveda or anything in the perspective of Ayurveda, we generally we are always in a denial mode to accept that side effects can happen. So, first of all, when you treat anything, you have to accept it that side effects may happen. And I strongly believe that if something that is not able to give side effect cannot give any effect also. So, when something is effective, then it may give side effects also. So, ayog, when you are giving patient for a snepan, patient is not taking sneh in appropriate measures. Ruksta will be there, and then also you are giving woman or Virechan Yog. At that time, you will feel that you have got proper Vegas, or in general, there will be no Vegas, but I have seen the practice that Trifla de do, Trivrudole de do, or ek de do, or, and we are achieving the goal. Actually, you will meet with your 16 Vegas or 20 Vegas, but after the Panchkarma, after Vaman or Virechan, patient will get rid of that ailment for what he or she has came to you. But some other thing will get developed. I have seen in many patients that allergies has been got developed. Even some patient got arm conditions after for following Panchkarma. Now, it is not only that we as a doctor or we as a Vaidya are doing these things. What we have to take consideration that Mithya Yoga, Ayog and Ati Yoga is solely on us that we have to decide. But Mithya Yoga happens because of the obligation or not obligation of patient. When we talk about chikitsa, we talk about chikitsa chatuspad, and patient is one of the chatuspad. So it is patient's uh, duty that he or she follows your instructions properly. If you will say that you have to take Gritpan in the morning before Suryodaya or whatever time, and then you will say that you have to drink warm water or whatever, yes, you have to take, eat mug the use or mug the odan, and patient is going for a junk food. He or she is not informing you. He is not following what you are saying. And then after some time, 2 or 3 days, patient will say that I have done this, I have done that, and yet we are doing Panchkarma. Yet we are not going for a strict action that if you have not followed us, we will not do this. You have to stop patient's Panchkarma at that point of time, so that the patient must realize the importance or the uh, deep effects of Panchkarma, that it is not just a walking therapy or you are not going for a like a physiotherapy sittings or something like that, that it will not damage you, because whenever you are taking Snepan or when you are going through the bastis, your body is a vulnerable part, vulnerable thing. You will get whatever Rishis or Vedyas or Samhitas are saying that you have to not to take Atap, Sevan, Vayu and all those. Why they have say that you don't have to take that? Because your body is vulnerable at that point of time, and if you are not following what is appropriate for that particular karma, then you will get disease after the Panchkarma itself. You may get rid of your primary ailment, but you will develop another ailment which can disturb you for a lifetime also. Because that, like allergy, like things, you will not realize that it has happened due to Panchkarma itself. So, actually, this is what I would like to say, or I would like to say that when you are doing the Panchkarma, uh, follow this slok properly. Ayog, Atiyog, and Mithya Yog. Always remember that. And if patient is not doing greatly, just think you find the ways to get out of these things. So basically, my very concern was that we are doing Panchkarma therapies in lot, and uh, specifically in Maharashtra and Gujarat, we are like a coastal region. So we have to take consideration about desh kal, bal vay anusar. We generally talk about it. So you have to decide karma according to this also. Generally, we denotes Panchkarma according to Kal only. When we think that if there is a Vasantik Vaman or Saradya Virachan, but you have to take consideration days also. And then patient's Prakruti, Bal, Vai, these all things we have to consider. But when we firstly decide, you have to take first days as a part of the consideration to which Panchkarma you are going to perform. So basically, do Panchkarma well, take Ayurveda at the next level, and best wishes from me. Thank you.
Thank you. Thank you, sir. Thank you, sir, for giving insights on the Panchakarma elements. Next. So now we are moving to our question answer sessions. Sir, we have some questions. So first question is, can we relate Pancha Mahabhut with Panchakarma procedures? So we have received a question. Can we
Yes.
correlate Pancha Mahabhut with Panchakarma procedures?
See, when we talk about Panch Mahabhut is a constitutional part of the body. Panch Mahabhut comprises of Panch Tanmatras, and they ultimately, yes.
Request everyone to please mute yourself. Sir, please continue, sir.
So, Panchmahabhut is part of the body's constitutional unit. So, when you do Panchkarma, you are treating one or two or maybe two or three Panchmahabhut itself. So, you can do correlate Panchmahabhut with for Panchkarma, but when you are doing Panchkarma, you are actually treating the Panchmahabhut, but with a diseased condition.
Okay. Thank you, sir. So next question we have received is Dipan Pachan essential before starting Panchakarma?
See, it is a very good question when you are doing the Panchkarma. Panchkarma or even any therapy, you just go to your any Samhita, you just read Jwar Adhyay and read Jwar's Samprapti. See, when I read Jwar in Samhita, I do not read Jwar as a fever. I read Jwar as a Vyadhi because when you read Vyadhis, different synonyms, there is Jwar, one of the synonym of Vyadhi. So, Vyadhi or Jwar's Samprapti, they said that vina arm, without arm, no disease can happen. Even the those dusya samurchana or those vikruti happens just after the arm gets vitiated or arm is generated. So whenever you want to do any panchkarma or even the rasayan therapy or even if you are you have started your OPD and you don't know anything about the disease or anything about the you if you are able to treat arm or if you are able to treat arm by Deepan Pachan. Deepan Pachan is a process to remove arm basically. So Deepan Pachan is basic and necessary and you have to follow it every time.
Thank you, sir. So next question is how Samsajan Kram is important during Panchakarma?
See, I already mentioned you that after the Panchkarma, patient get with Amvat. Now, uh, I, I told you before also that when you are going through the Panchkarma, your body is very, very vulnerable. You will get anything what you don't want from outside. If you are not ready or if you are not alert for your body. Now, Sansarjan Kram, what is Sansarjan Kram? Sansarjan Kram is that when you have done Vaman or Virechan, your Agni has gone diminished. So, to deepen or even आपका जो अग्नि है, you have to get your fire back. So it will not happen in that one or two medicine you will take and your fire will get back. Because when we are doing Homan or Virachan, actually we are doing the whole body cleansing, but main cleansing is done in gut. So gut is like just a newborn baby at that point of time, and you have never seen that newborn baby is given whole food. Even not after the 6 months we will start to give the chapatis and all the whole diet to babies. So you have to remember that after the woman viration, your body, your gut is like newborn baby. So how you treat newborn baby, you have to treat your body, but this will take 3 or 5 or 7 days of Sansajanakram to get to normal. So Sansajanakram is very, very important. And at that time, Sansajanakram is not only of diet, you have to take consideration of Atap and Vayu also.
Thank you, sir. Sir, last question we are taking is Rukshan is necessary before doing Snehapan? If yes, which medicines we can use for a Rukshan?
See, Ruksan is not a concept. It's a Ampachan. You have to take Ampachan into consideration. Ruksan is a Pravrudvat itself. So you don't have to do Ruksan of anybody. You have to just take consideration of Am over there. If there is the Amaj condition, and you can just go on to treat, and you will get so many Ampachan treatment. Even Langan is the best Ampachan. You don't have to give any medicine also. You can put patient on the Mudgo use or even Mudgo use and Odan itself, it will treat your arm.
Thank you, sir. Now we are moving ahead. Next, please. Now I welcome our today's chairperson. I give a brief introduction. Dr. Kalpana Gholap, madam. Madam has done BAMS from YMT Ayurvedic Medical College, Kharghar, Mumbai. Madam has done MD in Panchakarma in 2010 from R.A. Poddar Medical College, Mumbai. Madam is currently working as a professor and head of department, Panchakarma department in YMT Ayurvedic Medical College since 15 years. Madam is a PG guide and currently Madam is doing PhD. Now I request Kalpana Madam, please give us brief about your experience. Over to you, Madam.
Thank you, Dr. Datta, sir. First of all, good afternoon, everyone. Myself, Dr. For today's session. It is conducted by Gurukul Global Academy, and I'm talking about today's. As we know, in the modern era of healthcare, we often look for the newest solution always. But in Ayurveda, we understand that the most sustainable solutions are often most in our Sahitas only. But today we focus into our core of our science with today's topic, that is Sahita, Panchakarma, and ailments. I thank you so much to Dr. Mehul Joshi, sir, for that truly enlightening session. Sir, such a wonderful session by you. You have beautifully simplified how the ancient wisdom of the Sahitas is not just a theoretical, but practically we can use in our today's practice, treating us nutrition with the treating modern elements through Panchakarma. Even a difference between you also mentioned the difference between classical Panchakarma and emergency Panchakarma, how we can use in our today's practice. Sir also mentioned about the enlightening on the Ayoga, Ati Yoga, and Mithya Yoga of Panchakarma, and how we treat with those Mithya Yoga and Ati Yoga, Ayoga happen while Panchakarma. I'm truly thanks to Dr. Mehul ji. And as we conclude this clinical meeting, I would like to express my sincere gratitude to our guest speaker, Dr. Mehul Joshi sir, Dr. Datta Bapardekar, for inviting me. and to the Gurukul Global Academy for the organizing this online session. Thank you so much.
Thank you, madam. Next, we are offering you an online course on essential Panchakarma, and it is a 3 months online course which will be starting from 1st April. Next, we are providing you 6 days free webinar on Panchakarma commencing from 16th March to 21st March. It will be free and it is 3 to 4 p.m. available on Zoom meeting. So I request kindly all join us in this 6 days webinar. Next, the speakers for 16th March is Dr. Ravi Bhushan Sonavane sir, and topic would be Vaman Karma, concept to clinical. Next, on 17th March, on the 17th March, the guest speaker would be Dr. Amit Chavan sir, and the topic would be Ancient Detox Wisdom, Understanding Virechan. Next, on 18th March, our guest speaker would be Dr. Rajiv Tarpe sir, and topic would be Principles and Practices of Basti Chikitsa. Next, on 19th March, our guest speaker would be Dr. Datta Bapardekar, and topic would be Healing Through Elimination, the Power of Rakta Mokshan. Next, on 20th March, our guest speaker would be Dr. Atul Pawar sir, and topic would be anti-diabetic medications and Panchakarma. Next, on 21st, our guest speaker would be Dr. Prasad Kulkarni sir, and the topic would be Nasya Karma, a practical approach to health maintenance and disease management. In these all 6 days, our chairperson would be Dr. Ritu Wadhwa madam. Next, we also offer certificate course on integrated oncology. This will commence in short time. Next, we are also starting with this research methodology and biostatistics. This is a 1 month online course on research methodology and biostatistics for Ayurveda MD first year students. Platform would be online. This is a 1 month course and the course fee would be 2,999 and the syllabus would be as per the NCSM norms. Next, our next clinical meeting would be on 26th March and the topic would be Vandetva Chikitsa, a systematic clinical approach. In this clinical meeting, our guest speaker would be Dr. Priyanka Kamble madam and the chairperson Dr. Manisha Pawar madam. Next, now we are coming to the vote of thanks. I am thankful and my gratitude towards our today's guest speaker Vaidya Mehul Joshi sir and our today's chairperson Dr. Kalpana Dhomse madam. I thank our technical support team Mr. Yash and Mr. Ayush. My gratitude towards our Dr. Viraj sir and Dr. Bhalchandra Mahamuni sir. I am thankful for successfully making this event because of all you Ayurveda learners and scholars. I am thankful to all and I declare that our today's online clinical meeting is concluded. Thank you.